A lot of swimming programs believe they're doing everything necessary to prevent shoulder injuries. Unfortunately, shoulder pain is estimated at about 90% in some studies for elite swimmers between age group to college age swimmers. This is a huge problem that's not only impairing people participating in the sport, but also optimal results. If you're having pain, you're going to reduce the amount of strength you can produce and also just not enjoy the sport. And if you're not enjoying it, why are you doing it? You're not going to be giving it everything you can and becoming an elite swimmer. So one exercise I see all the time, even hop on some of the huge governing bodies or countries' websites, and they suggest doing the band rotator cuff exercise. If you're around the sport, I'm sure you've seen it, elbow next to side, maybe you put a little towel in between, and then you're just bringing your arm out to the side and returning. I've seen teams give this to swimmers, 50 of these before you get in the water every day from the age of 12 to the age of 30. Man, sounds pretty boring to me. However, this exercise in itself is not a horrible exercise. There is going to be some posterior cuff activation, which is a component of any good injury prevention program. However, oftentimes see swimmers doing all kinds of crazy motions during it. Go for it. Yep, they're moving their whole body. They're starting to arch their back doing these things, or they're just doing, partial ranges or flying through it because either they're using too easy a band or they're just bored out of their gourd. Okay? As one of the elite swimmers here tells me, he wants ripped rotator cuffs. Okay, well, we're not trying to get you an actual rip, but we want to build a strong rotator cuff muscle, and that is essential for helping protect the shoulder. Unfortunately, the rotator cuff muscle has many functions. Only one of its functions is to internally and externally rotate. And as you saw with this, and with Park's great acting, there's a lot of people that get away without even activating that muscle in the internal and external rotation. We also have to strengthen it by building its ability to stabilize the upper arm or humerus or the humeral head within the glenoid, which is a part of the shoulder blade. As we're swimming, we don't want to have the rotator cuff overly fatigued and not doing all of its jobs properly, which is what we are feeding into with just doing these band exercises. So you need to build a well-balanced injury prevention program. Combine that with correct swimming biomechanics, ideal or proper realistic swimming volume, and that's how we're going to get that injury rate down from the 90s, hopefully closest to zero or as close to zero as possible.